Hello everyone, my name is Sabrina Livermore and this is my presentation on the impact of working conditions on patient outcomes. Objectives for this presentation. Objective number 1, the learner will be able to identify at least 3 working conditions that can contribute to poor patient outcomes by the end of this presentation. Objective number 2, the learner will be able to list 3 poor patient outcomes related to working conditions by the end of this presentation. And the last objective is the learner will be able to identify 3 areas of the nursing environment that need improvement by the end of this presentation. So, what are working conditions? Working conditions, they refer to the working environment and aspects of the employee's terms and conditions of their employment. This covers matters such as organization of the work and work activities, the training, skills, and employability, health, safety, and well-being, and working time and work-life balance. So, what is a nurse work environment? According to Lake et al., the nurse work environment is defined as the organizational traits that facilitate professional nursing practice. These traits include the nurse's interprofessional relationships, the nurse's role in institutional decisions and quality improvement, as well as nurse staffing and patient care resources. In this presentation, we're going to talk about patient outcomes. So we define patient outcomes more simply as the results of the nursing care that patients receive in the hospital, including maintenance of patients' functional status, maintenance of their safety, and patient satisfaction. Favorable and unfavorable working conditions can both greatly impact patient outcomes, for the better or for the worst. Throughout this presentation, we will discuss healthy and unhealthy work conditions for nurses and the effects the environment has on nursing practice, healthcare, and our society. Influence on nursing practice. Healthy work conditions in patient care lead to less burnout, fewer medication errors, and more interaction with patients. The British Journal of Nursing explains how in several studies it has been reported that a positive work environment is associated with fewer occupational injuries, less burnout, and increased job satisfaction. The International Journal of Environmental Research and Public Health explains that having a supportive work environment, there is a 28% lower odds of developing nurse burnout, which is huge. On the other hand, unhealthy work conditions on nursing practice leads to burnout, call-offs, leaving their profession, inadequate care, medication errors, and increased stress. According to a study completed by the British Journal of Nursing, it was discovered that both nurse burnout and intention to leave are directly affected by their working environments. The World Health Organization defines burnout as an occupational phenomenon, noting its inherent relationships to the workplace, and it describes it as feeling emotionally exhausted, cynical, and ineffective in relation to one's work, colleagues, and clients. A phenomenon associated with how the work is designed and managed, and not at a personal context. Nurse work environment and the impact it has on healthcare. We can see here that a healthy work environment leads to higher patient satisfaction and shortened hospital stays. According to a study completed, positive work environments lead to a reduction in the frequency of pressure ulcers, pneumonia, and medication errors, according to the British Journal of Nursing. This also leads to shortened hospital stays and higher patient satisfaction and less adverse reactions. Healthcare is improved because of healthy work conditions. Unhealthy work conditions, on the other hand, and healthcare can lead to lengthened hospital stays, more readmissions, and increased alternative events and patient deaths. Unhealthy work environments lead to, as we had just said, readmissions, which leads to increased healthcare costs and poor patient outcomes, such as increased mortality and complications, according to the British Journal of Nursing. In the International Journal of Environmental Research and Public Health, they conducted a 2016 systemic review which found nurse burnout was associated with compromised patient safety including higher rates of medical errors and missing essential parts of patient care such as medication delivery, communication, and surveillance. The same study also found that burnout jeopardizes rapport between nurses and their patients, leading to lower patient satisfaction scores and being less likely to recommend the hospital to others. This slide, we are going to talk about work conditions and the impact it has on society. So healthy work conditions lead to the public being more likely to seek out care, more likely to attend their follow-up appointments, more likely to adhere to their patient responsibilities, which follows their patient rights, and this leads to them being more likely to care for themselves. Magnet hospitals, they are recognized for excellence in nursing care that have many of the features of good work environments, such as improved nurse autonomy, better staffing, and supportive management. An investigation completed by the International Journal of Environmental Research and Public Health found that magnet status hospitals were associated with a reduction in the effect of nurse burnout on patient mortality. Unhealthy work conditions and the impact on the society means that there is less time out of the hospital, which is the same thing as being in the hospital for longer periods of time. Patients and people in the community will be less likely to seek out care because of the way they were treated, fear of being in the hospital because of an experience. This leads to a bad reputation on healthcare and less trust to the healthcare profession. In summary, we need safe working environments. A safe working environment for nurses is characterized by good professional relations, a supportive management style, and a balanced work-life schedule, as well as concordance between nurses, increased workload, and their skill mix, as well as adequate time to meet patients' needs, professional autonomy, adequacy of resources, and opportunities for professional advancement. This was found in the British Journal of Nursing. It was also stated in the British Journal of Nursing, as much as we would love our working environment to always be perfect, the truth is that nursing is stressful. It's complex. There are staffing shortages and limited resources. There is so much pressure to get an unbelievable amount of work done in such a short period of time when you are being pulled in 100 different directions, while also being expected to keep your patients safe, happy, and healthy. Nurses at the bedside are tasked with continuous patient surveillance and medication and treatment administration while serving as first responders in the event of rapid patient decline. To provide safe, high-quality care, nurses need the resources and support to do so. Olds et al. Believe that to achieve the highest level of safety and quality, hospitals should invest in creating an environment supportive of nurses' work, including adequate staffing, management support for nurses, and good relationships among nurses and physicians. There is much work to be done. There has always been so much work to be done in nursing, staffing ratios, and what is and is not safe. Be the change you wish to see and make the difference. Thank you so much for viewing my presentation, and here are the references.